Our group did our country health profile project on Ghana. And so just to give a brief history of Ghana, Ghana was the first country in sub-Saharan Africa to gain independence in 1960. Despite its independence, Ghana has gone through decades of corruption, mismanagement, and military rule that served to stunt the growth of the country. In particular, it dealt with several coups and retaliation to said corruption. By the 1990s, however, the country's state of affairs began showing signs of improvement. Concurrently, the general health of Ghanaians has been improving since independence. Regarding the history of public health issues, many of the endemic diseases that Ghanaians had and currently deal with include malaria, pneumonia, and diseases of the gastroenteritis group. In addition, there are various other infectious diseases that plague the country. For example, I've listed that the cholera outbreak in 2014 was a major issue, the influenza epidemic of the Gold Coast in 1918 and 1919, and the first documented case of HIV or AIDS in 1986 is now more of a prevalent issue in Ghanaian society. And regarding the history of health-related institutions, the Ministry of Health was established in 1957. Following that, the Ghana Health Service was launched in February of 2003, and both are responsible for the provision of most of the healthcare for Ghanaians. And up until recently, the CDC began providing assistance since 2008 in efforts to support HIV/AIDS prevention and control, along with limiting issues of malaria and influenza.
So this slide talks about the demographics of Ghana. As we can see with the population pyramid, there's a relative balance between males and females with a general decrease as we increase in age. Something that isn't as consistent is the ethnic and religious compositions of the country. As you can see for the ethnic composition, there's an overwhelming amount of Akans. And then for religious affiliations, there's a big population of Christians, which definitely has an impact when we look at health. Next slide. So these are the broken down measures of health. Just in general, we can see a decrease where we kind of want to see a decrease in the aspects of mortality rate and different mortality rates and ratios for maternal, neonatal, and then the under 5 and under 1 mortality rates. We just see a decrease throughout the years. For things like life expectancy, we do see an increase. For females in 2017, it went from 28.4 to the 2100 prediction of 81.3. So that's something good that's increasing. For the dailies, the top 3 causes of dailies in 2020 were malaria, HIV/AIDS, and lower respiratory infections, which is something to continue to look at for Ghana. Next slide. And then last, we have culture. With the different ethnicities that we just previously saw in the demographics, we have a lot of different culture in Ghana. And so some of the cultural norms that influence health are listed. One in particular is the history of female genital mutilation. That is decreasing, and that was because of the awareness that got on it. So just the looking at cultural norms in terms of health. Another big one is the traditional medicine reliance. 70% of Ghana relies on traditional medicine still, which is something big to look at when looking at their healthcare. Next slide.
In the past 2 decades, Ghana has advanced immensely under their multi-party system. Ghana ranks in the top 3 of African nations in their social capital, partly due to broadcast media and radio. Their peaceful election has allowed President Akufo-Addo to make successes in planting for food, implementing jobs, and jump-starting secondary education. However, Ghana faces many challenges ahead. Providing dam energy, educational tools, and employment opportunities is difficult to achieve with 216 districts. Rural outreach is especially hard as the main income is agricultural crops. Ghana is rapidly ahead of other African countries, but still far behind the world's most developed nations. It is labeled as a low-income economy, and numerous citizens experience some sort of poverty. Next slide. Ghana has 3 primary industries: mining, electricity, and tourism. The Ghana mining industry contributes over 5% of the country's GDP. Minerals account for over 37% of their exported products. However, their gold reserves are the most recognized in Africa. Ghana powers 23 large-scale mining firms that produce gold and diamonds. Furthermore, over 300 small-scale firms are currently registered and operating. Ghana is a tremendous believer in clean, renewable energy. In fact, 49% of its power originated from renewable energy in 2012. In 2016, Ghana implemented the Ghana Grid Company, which built solar plants all over the country's terrain. In addition, Ghana has several wind turbines in its high wind environments. Finally, tourism is integral in Ghana's ever-growing economy. It accounted for over 4.9% of the country's GDP back in 2009, and it rakes in nearly $2 billion in revenue per year. Ghana's all-year tropical warm climate, along with its exotic landscape, continue to push Ghana's tourism sector to Africa's forefront. Next slide.
The education system in Ghana is ranked 104th out of 195 in the world and 12th out of 54 in Africa. According to the website for the U.S. Embassy in Ghana, the country operates on a 6-3-3-4 schooling system. This includes 6 years of primary school, 3 years of junior secondary education, 3 years of senior secondary education, and 4 years of university. In primary and junior secondary education, there is about 90% enrollment within the population of Ghanaian children. The official language of instruction is English, but students may study in their local language for the first 3 years of primary school. After that, students study in English while continuing to learn a Ghanaian language in addition to French. Primary school and junior secondary school have been free to the public since 1995. However, senior secondary education just recently became free in 2017 under current President Nana Akufo-Addo's administration. The year that this policy was initiated, the enrollment number for senior secondary education grew from 308,000 to 430,000 students. This policy was created to reduce poverty by lifting the burden off of parents to pay for their children's education needs. In turn, this policy has also reduced unemployment drastically. Though Ghana has been busy accommodating for more students by building more schools and hiring more teachers, this initiative has proved itself to be well worth the efforts. Next slide.
The healthcare system in Ghana is still evolving. Over the past 2 decades, there has been significant push by the government to improve the healthcare system in Ghana. So in 2003, they introduced their form of universal healthcare in which they passed their national healthcare insurance scheme bill in 2003, which overhauled their previous cash and serve system, which now meant that the citizens could get treatment for emergencies without having to pay up front. And even though this new health insurance paid for basic medical services, the standard of care differed across major cities in Ghana. There are numerous hospitals, clinics, and pharmacies available in major urban areas such as Accra and Kumasi, with each having about 2 million residents. However, the other 28 million residents of Ghana, they don't even have access with basic health care facilities. And this means that a lot of these citizens go to traditional treatments rather than going to see a certified doctor that are based far away. Therefore, Ghana needs physicians and medical facilities in small rural towns where most of the population lives, but it's kind of hard since a lot of their specialty pharmacists and physicians acquire their certification in other countries and stay there. This is evident by the amount of doctors per 1,000 people, and it's very low compared to it's about 0.6% compared to about 3 in the United States. And over recent years, the lack of funds the government has provided towards healthcare has decreased their budget, which meant that a lot of their medications have started not to get paid by the government. And this meant that even when people start medications, they can't afford medications throughout the entire treatment plan. Next slide.
Ghana's progress on Millennium Development Goals has been mixed. Targets such as cutting extreme poverty by half and cutting the proportion of people without access to safe drinking water by half, universal primary education, and gender parity in primary school have all been attained. Substantial progress has been made in reducing HIV prevalence, increasing access to information and communication technologies, and reducing the proportion of people suffering from hunger. However, only slow progress has been made on full and productive employment, an equal share of women in non-agricultural wage employment, and women's involvement in governance, reducing under 5 and child mortality, reducing maternal mortality, reversing environmental resource loss, and improving sanitation. Next slide. The Sustainable Development Goals are a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. Adopted by 193 countries, including Ghana, the SDGs came into effect in January of 2016 and aim to foster economic growth, ensure social inclusion, and protect the environment. Considerable progress has been recorded in the key indicators on social goals, but not at the rate required to achieve SDG targets by 2030. Overall poverty, malnutrition, maternal mortality, under 5 mortality have all declined. While there has been a general increase in access to health services and school enrollment with gender parity attained at basic level. There's been a general improvement in the macroeconomic environment with some key indicators pointing in the right direction and economic growth recording significant improvement. Overall performance has been mixed. Single-digit inflation has been sustained for several years, leading to a downward trend in interest rates and the budget deficit. However, unemployment has increased, especially among the youth and urban population. The proportion of youth not in education, employment, or training has also increased. The proportion of population with access to basic water services and sanitation improved, as well as the ambient water quality. However, air pollution, open defecation, and the number of people affected by disasters has worsened. Next slide. This slide shows the icons for 16 of the social development goals arranged in a circle around goal number 3, good health and well-being, in the center. This arrangement reflects that many, if not all, of the other 16 are connected to health. Addressing the social determinants of health that are embodied in these other goals is a primary approach to achieving goal number 3. Health in turn feeds back to the other goals and will boost or impede their success. Health and well-being are shaped by the conditions in which people are born, grow, live, work, and age, and that these conditions are shaped in turn by structural, economic, environmental, and other factors, including governance, organizational, and policy choices. The reverse is also true. Improvements in health and well-being drive broader sustainable development. For example, reductions in poverty and inequality, better education outcomes, and inclusive economic growth. Health and well-being promote resilience, sustainability, integration, equity, and human security. As we have seen, Ghana has made progress, but has challenges that it is attempting to address with varying degrees of success.